Shocking new report into the death of a veteran in a state facility. The Minnesota Department of Health says a nurse's neglect led to his death. The investigation centers around an incident at the Minnesota Veterans Home in Minneapolis on the banks of the Mississippi River. Our Morgan Wolf went through the report, brings us the latest now. Morgan?
Yeah, Rena, we learned through this investigation that a nurse at the Minnesota Veterans Home gave a resident 20 times their prescribed medication. The family of that veteran says that they are in utter shock and disbelief.
This summer, on Friday, July 25th, a resident at the Minnesota Veterans Home was reported dead. An investigation into their death reveals what the family calls a tragedy of errors. The Minnesota Department of Health details the man's diagnoses, including a stroke, diabetes, and dementia. The report walks through how an overnight nurse was scheduled to give a resident 5 milligrams of morphine and instead administered 100 milligrams without immediately realizing her error. The overnight nurse supervisor went to that nurse and questioned her order of the medication. That was when the nurse realized her mistake, but not initially, thinking that she administered 20 milligrams when it was actually 100 milligrams, according to the report. The investigation shows that the nurse confused milligrams with milliliters. The error was reported wrongly also to the on-call physician, who says that they didn't know it was 100 milligrams until after his death. Administration policy requires 2 nurses to view narcotic orders, which they did not that night. In an interview, the nurse says that she was in disbelief and felt terrible. She went home suspended that night, and after an internal investigation, she is no longer employed. The family of the man says that they are in utter shock and will not ever be whole again.
The Minnesota Department of Veteran Affairs says that they have been addressing this incident and will continue to. In a statement, they said, quote, "No resident harm is acceptable, and MDVA continuously focuses on improving the quality of care and safety of all Minnesota Veterans Homes residents."
Did this have anything to do with not having the proper training?
I think that's a question a lot of people are wondering, but according to this report, this nurse says that she was properly trained, but the nurse said in an interview that she didn't know about this policy when it came to the narcotics requiring 2 nurses to sign off on the orders.
All right. Thank you, Morgan.